Hello, everyone. Welcome to another edition of FitRx. I'm your host, Dr. Greg Dennis. I am super excited about today's guest as he's kind of a big name out there, really one of the grandfathers of anti-aging medicine. He's been doing this for a pretty good while. He could really talk about any subject, on anti-aging, but I really want to focus today on ozone therapy, as he is really one of probably the world's leading experts on ozone therapy. He teaches physicians like myself to incorporate ozone. I was recently at one of his trainings. So you may have heard me recently talk about ozone therapy and how we have implemented that in our clinic. And so I'm excited to just kind of shed some light on that a little bit. So my guest today, Dr. Frank Shallenberger. He has written, again, multiple books. Just been around, done a lot in this field. I'll let him tell you a little bit more. He's written a book specifically on ozone called The Ozone Miracle. Again, that's where we're going to kind of hone in today. So Dr. Shallenberger, it's an honor to have you on the show. So welcome.
Glad to be with you guys, Greg.
All right. Well, let's start off. Tell us, take us way back, because ozone, when I start talking about ozone, people just kind of look at me like that's random, So how in the world did you discover medical ozone therapy, and just kind of talk us through that evolution with you, and then how you began to incorporate that?
Yeah, it started back in the early 80s. And back then, the word on the block was what everybody now commonly accepts, but this was kind of a new concept back then. And that was about how oxidant stress and free radicals are at the very heart of not just the aging process, but pretty much all diseases. Production of these harmful molecules called free radicals. And at the time, I had discovered that in Germany, they were infusing blood with ozone. Now, ozone is a very potent oxidant. And so it seemed ironic to me that they were giving an oxidant to treat diseases that were caused by oxidants. And so I went out of my way to learn more about this. And actually, I took a trip back in Germany way back in the early 80s, kind of like what you did, Greg, just recently with my seminars. And I took a seminar from a woman by the name of Renata Debon. Her dad is one of the great grandfathers of ozone therapy, going all the way back to the 50s. I was shocked to learn that ozone therapy is a medical treatment that has been in use since the late 1800s. And yet this was 1980, and I just had never heard about this. And so I took the class, and I learned what to me then was just not all that comprehensible. And that is, if you have an excess of oxidant stress in your body, you can overcome that by giving an oxidant treatment in very small dose. So a small dose of the bad thing actually corrects bigger doses of the bad thing. This is a homeopathic principle, which in fact it works. And that's how I learned about it. That's how I came onto it. I came home after the seminar and thought, I'm going to try this on some of my patients. And it didn't take me long before I figured out that this is pretty remarkable stuff. And it was, after about 5 or 6 years of doing that, Greg, that's when I started teaching docs here in the US how to do it, because at that point, hardly anybody in the United States did this at all.
So that was about what year? About how long have you been doing this?
So I started the seminars in the late 80s.
Okay, so you've been doing ozone for a long time.
Yeah.
So talk about, so in your book, and of course you go into detail how it works, but you talk about just unlocking the power of ozone, and it really is indicated for about everything. And when I tell people that, it almost sounds too good to be true. But I'm like, well, it's working at the cellular level, so therefore that's why it's treating so much. But so talk about that a little bit more, maybe what some of the main indications are, and why it's so effective for such a broad range of diseases.
I think what everybody wants to first remember is that ozone is pure oxygen. So once you understand that it's oxygen, that automatically allows you to sort of understand, yeah, this could be applicable in a whole bunch of things. Because when you stop and consider about it, there's nothing that even comes close to how valuable oxygen is to human health. You can go without eating or drinking water, but you for a long time, but you can't go without breathing for very long. And you need that oxygen. That's what keeps us alive. And so ozone is pure oxygen, except regular oxygen that we're breathing in has 2 oxygen atoms, whereas ozone has 3. And that's that third oxygen atom in there that makes it very powerful. So if you treat the body with just pure oxygen, it's good and it can be helpful. But you treat it with ozone, that third oxygen atom in there does things that regular oxygen can't do. So that's the first thing for people to realize. The next thing is that for a lot of reasons, and those reasons are things that most people understand. For example, toxicity, drugs, stress, bad lifestyle habits, bad diets, all those things that we know are bad for us, they're all bad for us because they interfere with the way our bodies use oxygen. And at the very bottom line of virtually every disease is this problem that where we don't use oxygen properly. Another way to say that is if my body can use oxygen very efficiently, I'm just not going to get sick. But as I age, as I get older, and I get more toxins accumulate in me, or maybe my lifestyle habits aren't good, or I contract an illness or whatever, what's going to happen is my ability to process that oxygen is going to decline. And that is the beginning of everything starting to unravel in my body. So what's unique about ozone is that it can turn that around. It revs up your body's ability to use oxygen efficiently. And since that principle that I just stated is a factor in every single chronic disease, you can then understand how using ozone therapy can be applicable in every single disease. The thing to remember, for people to remember, is, we're used to drugs. So you have a problem, you take a drug, and it's devoted to that problem. It could be an antibiotic, could be a blood pressure pill, whatever. But it's devoted to that particular problem. There's no drug out there that you just take for everything. Drugs are focused on individual things. Ozone's not. Ozone is not a drug. It's a stimulant. It stimulates the body to work more effectively. I've talked to you about how it stimulates the body to use oxygen more efficiently, but it also stimulates the body to do all kinds of other things more efficiently. So that's how the book's called The Ozone Miracle, because that's almost miraculous in concept, how one molecule can be so instrumental in so many properties in the human body. Is really remarkable. But that's the way it works. Ozone does this, and listeners should know that there are thousands. We're really just got over the 3,000 paper hump last month, but there are over 3,000 published papers in respected journals throughout the world on the efficacy of ozone therapy. Keeping in mind, it's been around for over 100 years. So there's lots of papers on it. And this stuff is for real.
So on that note, and I think I know the answer to this question, I'm sure a lot of my listeners do as well, but with this being so effective for so many different diseases and all the studies that you mentioned, why is this not more mainstream?
Yeah, that's the question. Actually, that's one of the chapters in the book, because that's the big question. If it's so darn good, how come everybody doesn't use it? Oh boy. I guess I would explain it this way. First of all, in medicine, things don't get accepted immediately. So we know that. So something will come out, and it might take 50 years for it to be incorporated in medicine. Uh, I think it took penicillin something like 15 years, 5 years to get incorporated into the regular doctors that are prescribing. So medicine's slow to make changes. It's slow to accept new things. That's part of the answer. But the real answer is, honestly speaking, big pharma controls medicine. Big pharma controls medicine. Big pharma wants to sell drugs. You start incorporating ozone in your practice, you're a doctor, and you start incorporating ozone in your practice, guess what? You're not going to be using drugs so often. You're not going to need those drugs. The ozone's going to correct things. So big pharma does not like anything it can't patent. And as Horst Kief once said, who's a German researcher and clinician in Germany back in the 70s, he once said, if ozone were patentable, it'd be used by every doctor in every hospital in the world. But it's not patentable. You can't get a patent on a natural substance. And that's really why it's not accepted. If pharma could get a patent on it, trust me, it'd be out there in a heartbeat.
Yeah. Talk about it. And I know you said it's, the Ozone Miracle, so it can really help with about anything, but you've been doing ozone for, a long time. What are kind of the main, or are there like a top 3 or top 5 illnesses that you've seen the most dramatic results with using ozone?
Yeah, for sure. The first thing that comes to mind would be cardiovascular disease. And the second thing that comes to mind would be pain. Ozone is incredibly effective at getting rid of the problems that result in coronary artery disease, cardiovascular, small vessel and large vessel disease. And I could say it's pretty much close to a slam dunk. If I were to get a patient, well, I get them all the time, but if I were to get a patient that has coronary artery disease and is on 5 different drugs for whatever they're doing, I can pretty much promise you, after a course of ozone therapy, in conjunction with other things, by the way, I don't want the readers or the listeners to think that ozone is this panacea and you just use it by itself and it does all these incredible things. It does do a lot of incredible things, but you don't typically use it by itself. You're going to tell the patient, listen, I want you to eat this way. I want you to sleep this way. I want you to change your lifestyle for a more healthy lifestyle. But while you're doing that, when these patients that have cardiovascular disease, you add ozone therapy in there, it's pretty close to a slam dunk. They're not going to have any more heart attacks. The blood pressure is going to normalize out. You're going to have really good circulation. Their ulcers, if they have circulatory related ulcers, those will heal up. So cardiovascular disease is huge. It's the #1 killer in the United States, and yet this disease is completely curable without like major interventions. The other thing is pain. It took me a while to realize this and appreciate this, but ozone literally takes away pain. It's astounding. And one of the examples I like to give, because this really speaks to the issue of how it directly affects pain. By the way, when I first discovered this decades ago, its pain relieving effect, I went and called up a bunch of pain specialists and I asked them, what's you guys are the specialists in this field. What causes pain? Because I wanted to know what causes pain because ozone got rid of it. So But all the pain specialists at that time, this is maybe 10 years ago, told me, we don't actually know for sure what causes pain. And I said, well, I can tell you something. It's got something to do with oxygen. Because and then I would tell them this story that once I had a lady that was coming in and she had a torn rotator cuff. That's a shoulder injury. And about the third treatment, and her pain was going away and her rotator cuff was healing. About the third visit, on the way out of the room after the treatment, her husband got a hold of me and said, you know what, I just want to ask you this. About 15 years ago, I was wrenching something on a car engine, and the wrench slipped, and the back of my hand went and banged again really hard against some metal object in there, and like right around here on the back of the dorsum of his hand. And he said, ever since then, it's hurt me to the point where it's kind of difficult to open a doorknob, to turn a doorknob, or use a screwdriver, or sometimes grab something. He said, I've been to see orthopedists. They've done the pictures, they've done everything. It just hurts. Nobody can figure out why. He said, do you think you could help me with that? I said, well, let's find out. So I took a 5 cc syringe of ozone, and which, by the way, for the listeners, is a gas. It's not a liquid. It's a gas similar to oxygen. But I just took a 5 cc, pinched up the back of his hand, just went under the skin, shot some ozone in there, about 5 cc's of ozone. Next time I saw him, he told me, hey, look, pain's completely gone. Amazing. 15 years of pain. I didn't do anything. It just put some oxygen in there. So I'm absolutely convinced that that the reason we have pain in certain areas of our body is because there's a lack of the ability to utilize oxygen in those areas, which produces excessive acid, starts breaking down the healing ability of the body, and it just never clears up. And remarkably enough, if you just put some ozone into these painful areas, the pain goes away.
So just for the listeners, what I'm doing at my clinic so far is just IV ozone, to where we're drawing your blood, we're putting it in a bag, we're injecting ozone into the bag. So basically mixing the ozone in your blood. Now you have ozonated blood running that back through. And I think maybe what you're talking about is putting ozone into joints or other areas in the body. And I know you put ozone, you do vaginal insufflation, rectal insufflation. You put it about anywhere. So just, I guess, talk, if you will, a minute about all the different options that are available for ozone treatments.
Yeah, really good point. So I think the only place I haven't put ozone is directly into the brain. Simply because I don't know how to do that safely. Otherwise, I probably would. But I have put it in ears. I've injected it in every part of the body you can imagine. Mostly we inject it to those parts of the body that have pain. So that's going to be the spine, the neck, the lower back. We do a lot of joints. So that's shoulders, elbows, fingers, feet, knees, hips. You can, with chronic bladder pain, you can inject it into bladders. With vaginal problems, you can inject it into a vagina. For rectal problems, you can inject it into a rectum. You can put it in the colon. You can inject it into just soft tissue. So if you have a contusion or some sort of injury, you can inject ozone right into that area, similar to the case I just mentioned. If you have a fracture in an area, you can inject ozone down into the fractured joint, and it'll make it heal a lot faster, and it'll also additionally take away the pain. So I've injected it into caudal epidurals, which is a space down in the bottom of the spine. So it actually kind of gets in with the cerebral spinal fluid. I've injected it epidurally. You can put it right into the cerebral spinal fluid. The only thing I haven't done is I haven't injected an eye. I'm pretty sure you can. Yeah. There's one study where they took rabbits that have macular degeneration and they injected it into their eye, and they were able to show in the study that it didn't hurt the eye, how well it helped the animal's vision. They weren't able to document, but it didn't hurt the eye. So you could probably put it into an eye. But outside of an eye and a brain, I've pretty much shot it every place. 100% safe. I mean, the worst that could happen with this treatment, Greg, is that it doesn't work.
Yeah. So specifically for like IV ozone, which is what I'm doing, and say we're treating a cardiovascular disease, most people want to know how many treatments they need, and it probably depends on the condition, but talk about maybe the number of treatments,
Yeah. So I want the listeners to think about exercise. And let's say you've got somebody who's in bad physical, bad fitness, is not in a good state of fitness, and you want that person to go out and exercise. Let's say they want it by the end of the year, they want to be able to run a marathon. So what are you going to do? You're going to start them off easy. You're going to say, okay, I want you to go out and run 3 times a week, run 1 mile, maybe 3 times a week. And then after a couple of weeks of doing that, we're going to increase it to 2 miles 3 times a week. And then after that, we're going to increase it to 2 miles 4 times a week. And basically, you're progressing up and up and up. And as you're doing this over time, that person's getting in better and better and better shape, so that at the end of a point of time, that person can actually go out and run 20 miles in a halfway decent time. But he couldn't have done that immediately. He had to work up to that. And that's so analogous to the way ozone works. When ozone goes into my body, in the way you're using it, it's going to stimulate all of my cells to work better. And that's what we want them to do, is to work better. But it's going to require multiple treatments gradually to get to that level of fitness in the cells. It's not going to happen instantaneously. We're building up the cells, we're training them to get more efficient at doing what they're doing, and it's going to take some time. Now, how much time that is varies on the person. I would say that probably the minimal amount of times you're going to have to do an ozone treatment, as you're talking about, would probably minimal is 12 times before you see much anything. After 12, you're going to see something, but you might need to do 20, you might need to do 30 to get the absolute full effect. A good example would be macular degeneration. Ozone therapy, the kind you're doing where you take the blood out, ozonate it, is super good for macular degeneration. But you're not going to see anything until you get about 12, 13 treatments. Then the patient's going to start saying, oh yeah, my symptoms are starting to go away, I can see a little bit better, and you can document that with various tests. But at some point, you're going to be able to say, okay, we've maxed out on how much we can help you here. So at that point, we're going to go into a maintenance schedule where we just maybe get you every now and then. It'd be similar to the marathon runner. After he gets up to a certain level of fitness, he doesn't have to keep working that hard to maintain that. He had to work really hard to get there, but to stay there, he can work less hard to stay there, and that'll maintain him. Similar with ozone treatments.
Gotcha. So is it fair to say most treatments are going to take, or most conditions are going to take maybe 10 to 12 treatments, and then after that, and maybe 1 to 2 times a week, and then after that, maybe people can spread it out to every other week or monthly just for maintenance? Is that pretty fair to say?
Ozone works in conjunction with all kinds of other things in the body and in the cells. It doesn't work as a solo molecule. It depends on that patient having enough thyroid hormone. It depends on that patient having enough B12. It depends on that patient having enough of the various minerals and the vitamins and things that we need. It depends on that patient getting adequate sleep. It depends on all these other factors. It's a stimulus, but it doesn't work in a vacuum. Lots of things have to be in place. So let's say I've got a patient with the problem and I'm treating that problem. It's going to be darn rare, if ever, I'm only going to talk to him about ozone therapy. Normally, I'm going to talk to him about how he lives, what his lifestyle is like, what does he eat, blah, 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 go into all those things that, we're used to. And so then I add in the ozone therapy. Now, if at the end of 12 ozone treatments, I don't see that he's particularly getting better in the way he ought to, then what I know is I missed something. Or maybe I missed a couple of things. Or maybe I didn't miss him and he's just not doing it. But you should definitely see something, I would say, within maximum 15 treatments. You should see something significantly clinically noticeable.
Now, is it a hard sell for people because that's a big investment of not only time to come up there to do these treatments, but it's a financial investment as well. Do you find that that's a hard sell for people?
Sometimes, I think we're all conditioned to a large extent that if insurance doesn't cover something, that's nothing I want to get involved in. People, they spend a huge amount of money for their insurance coverage, and it's a super drag to find out that the treatment that they really need is not covered by insurance, and ozone isn't covered by insurance. So that's a big drag, and I guess people have to come to the opinion that the money's worth it. But it's a bit of a hassle. I mean, I can tell people it's safe. It's not going to hurt you. I can't even guarantee them that it will work, Greg, because there's so many factors that go into this. So they just have to get to the point where, but I don't know about you, but for me, most of my patients that I get, I'm like the last guy. They've already seen 3 or 4 other doctors, that are taking insurance and doing insurance covered related things. And they've come to the end of the rope. They're saying, look, I got a big old bad problem. And I've seen all these conventional medical guys and they're not helping me. And so, I'm willing at this point to go through the hassle and go through the expense of trying something that's different.
Gotcha. So since I've been doing this, which has just, been a few months now, I've seen some people, and even for myself, because I've had several treatments. The very first treatment I had, I was really had a lot of energy. And then this most recent one I had, it really made me tired. And I sometimes get that from patients, especially on their first treatment, how it makes them tired for that day or the day after. Doesn't do it for everybody, but what's going on there? Can you explain that?
I see the same thing. That's not unusual. And I would just have to say that there are other factors going on. I mean, that's the only thing that can account for it. You're doing the exact same thing twice and you're seeing a different reaction. So there's got to be some other factors that are involved in that. It can't be the ozone directly. It's got to be some other factor involved in that. I will say that, for example, ozone's a metabolic stimulant. What a metabolic stimulant does is it revs up your metabolism. That means it produces more energy. For some people, that means their blood sugar is going to go down. And if they don't have a decent adrenal gland, on that day, by the way, if their adrenal gland's kind of suppressed on their day, their blood sugar may go down too fast, too low, and they'll feel weak as a result of low blood sugar. So, there's probably other things that can happen. That's probably the single most common. Ozone will tend to lower the blood sugar. It'll tend to lower the blood pressure a little bit too. So that could be something. But we always tell people, listen, before you get your treatment, make sure you drink a lot of water, you're well hydrated, and make sure you bring a sandwich in or something to eat before and right after you get the ozone treatment, because it might. And even while you're getting the ozone treatment, they can be sitting in there eating something to make sure their blood sugar doesn't fall. If it happens in the afternoon, you're giving an ozone treatment in the afternoon and you're saying that, I can almost promise you it's a blood sugar issue.
Interesting. Okay. So again, since I've been doing this for just a few months, one of the most remarkable results that we've been seeing is this post-COVID syndrome or COVID long haulers. It's been, gosh, I'm going to say almost 100% success rate with some of these kind of COVID long haulers, whether that be fatigue or, just not thinking clearly, things like that. What's going on with that? Why is ozone so effective with that?
I'm not sure, but I can tell you a certain number of things that have occurred to me because we see the same thing. And that is one, we know from what's been published in the literature that the COVID virus contains this spike protein that everybody's heard about. And that spike protein can aggravate the part of the cell called the mitochondria that produce energy. That's the part of the cell when the oxygen goes into our cell to produce energy, it goes into the mitochondria part of the cell to produce energy. All these long haulers, their number one complaint is low energy. That's the number one complaint they have. And I think a lot of it is because the spike protein has affected their mitochondria and kind of produced a toxin in their mitochondria where they just don't process the oxygen that well. Well, ozone's a potent mitochondrial stimulant, and it'll clean up the mitochondria and get them to work better. The other thing is that you've got this virus in your body, and you've got to eradicate it. You've got to control it so it can no longer replicate. The way you do that is by stimulating a certain part of the immune system called the innate immune system. Scientifically, it's the Th1 subset of the immune system, but it's what we also call the innate immune system. That is the one that's responsible for corralling and controlling any viral infection. Ozone therapy works literally on any viral infection. It doesn't matter. We've done West Nile virus, we've done hantavirus, obviously influenza A and B. We've done meningitis virus. Any virus you can think of. Bird flu, we did bird flu. Some of the researchers have done Ebola. It works 100% of the time for viruses. So why is that? I'm pretty sure it's because it stimulates the innate immune system, which if you are infected with a virus and your innate immune system is not on board, you're going to be suffering from that virus for a long, long time. This long hauler phenomenon from COVID is not a new thing. We've seen long haulers from all kinds of viruses for 20, 30 years. Because this problem with the innate immunity has been there for a long time. There's a lot of people out there that just have poor innate immunities. If they get infected with a virus, there's a chance they're not going to recover in the way that normal people would recover. Ozone stimulates that innate immunity. It's a powerful stimulator for that. So I think between those two, detoxifying the mitochondria, stimulating the innate immunity, that's probably the key to why it works so well.
Is there anybody that would not be a good candidate for ozone?
There are contraindications. And the sort of the first ones that come to mind are acute events, acute heart attacks, acute strokes, acute seizures, any kind of acute disruption in the body. That's not the time to go in and give a stimulant. That's the time to put the patient at rest and to give medications to calm things down. So if you're having an acute heart attack, if you're having an acute stroke, you need to be in the emergency room getting the medications and all the things that they're going to do to you there to do what we call stabilize you. So now you're out of the acute event and you're stabilized and you're okay. Once that happens, which could be in 4, 5, 6, 7 days, something like that, then you're safe to do ozone therapy. But you do not want to do ozone therapy in acute situations, except in acute viral illnesses. We can do them in acute viral illnesses, but acute cardiovascular stuff, acute neurological stuff like seizures and such, you wouldn't do it there. And then there is a fairly rare disorder where people don't have enough of a particular enzyme called G6PD. It's certain people just don't have enough of that enzyme. If they don't have enough of that enzyme and they get exposed to too much oxidant stress, which ozone is a form of oxidant stress, so is exercise for that matter. Their blood cells, the red blood cells will what we call hemolyze, or break apart, break open. And they need that enzyme to protect the red blood cells from breaking open when they're exposed to an oxidant stress. There's certain people who don't have enough of that enzyme. So one needs to be a little bit careful when they're given the ozone treatment to people, to make sure that they're monitoring that patient and he's not breaking down his red blood cells. This has happened to me a few times. And when it happens, as long as you know what you're doing and you're on it, you just withdraw the ozone therapy and everything's okay.
Gotcha. So as long as you have been doing this, I'm sure that you have multiple stories of just kind of dramatic turnarounds in people's diseases, but give us one or two that maybe stand out in your mind over the years that you've been treating people with ozone.
I don't know that there's anything sort of that I would necessarily call dramatic, other than the pain issue. I mean, that can be dramatic, and I could tell you cases of people who've been suffering from pain for 15 years, addicted to narcotics. I mean, it's really bad. And 20 minutes after I give them the treatment, 20 minutes later, they start crying. They break out in an emotional outburst because that's the first time they haven't had any pain. I mean, it literally can go away in 20 minutes.
Are you talking more? Are you talking more about injecting the ozone into that area, or in like IV ozone?
No, putting the ozone right into the area.
Okay.
That's a very dramatic thing when that happens. When somebody's been suffering from pain for a long time, and in 20 minutes it goes away, you can imagine what they must be going through their mind. Oh my goodness, I've been suffering with this pain for 20 years, and this guy just took it away in 20 minutes. That's crazy. Most of the time, it's not so dramatic. Most of the time, it's kind of like we were alluding to. You've got to do it for weeks, maybe a couple of months, and then things start turning around. The thing that would be dramatic, maybe, is that you've got the patient that's had a disease or condition for a long time, and even though it might have taken them, and they've never been able to get rid of this problem, and even though it might have taken them 3 months of ozone therapy to get rid of the problem, still, that's kind of dramatic that they got rid of it.
Okay. Now, so back to the pain, can they get similar results with IV ozone, or do you really need to inject it into the area?
That's a really good point. And most of the time you can just inject it into the area. But there are going to be certain cases, and I'm thinking mostly of regional complex pain syndrome, which is a severe, very difficult to treat chronic pain issue that has a systemic component to it. And so I would say, in those cases, you would want to use the MAH systemic blood treatments in conjunction with the local treatments. But most of the time, you can just do it locally.
Okay. Well, I guess my question is, if you didn't do it local and you did the MAH, which is the blood, for the listeners, I mean, and you did say multiple treatments over time, would you get the same results as injecting it into the area?
I don't think you get the same results. You might, and it's certainly worth a try. But I think sometimes you have to go right into the area where the problem is. Because I didn't mention this before, but ozone not only gets rid of pain, it can also stimulate the healing process so that the abnormality that's in the body, let's say the joint, let's say the knee joint, somebody's got knee pain. There's something wrong with that knee. Usually it's arthritis, but there could be a torn ligament in there or something. There's something wrong that's causing the pain. When I inject ozone in there, it's going to get rid of the pain. But the other thing that it can do is stimulate the body's regenerative healing process such that the thing that caused the pain now heals. That's more slowly. It's not so dramatic as the pain relief, but it'll actually fix the problem by regenerating the area. And I don't know if that's going to happen with simply a systemic treatment.
Gotcha. Okay. Well, as we begin to wrap up here, anything else specifically about ozone that you want to throw out there that I didn't ask or that we haven't talked about?
One of the things that I always like to remind everybody, and I'm not trying to make it a big point in my seminars when I'm talking to the practitioners, is that ozone is so applicable to so many things. And very often, the things that ozone treats are the things that are missed with all the other stuff that we do. Because there's nothing quite like ozone. There's nothing like that molecule, whether it's vitamin C, vitamin B12, a drug, a hormone, whatever. None of those things has the potential that ozone has, the pure oxygen molecule has. Therefore, whatever practitioner does, whether they're a cardiologist, a neurologist, a urologist, gynecologist, acupuncturist, herbologist, chiropractor, whatever it is that they do that's effective to help people, they're going to get better results when they add ozone into it. I always encourage them to keep doing what you're doing. You know, if you're a cardiologist and you're putting stents in, okay, I don't much like stents, but there's a place for them. But if you're putting stents in there, fine, give them ozone therapy at the same time. Stents will work better and they'll recover better and be less dangerous. So everything that a practitioner might be doing, when they add ozone into it, all of a sudden their results just got 20% better.
One thing I forgot to ask you at the beginning, because I get this question from people, is they'll say, well, I thought ozone was a pollutant, from the environment. That's where most people have heard of ozone. So kind of dispel that myth just quickly, if you would. Yeah.
Okay. So you hear this a lot. In fact, I think we talked about this in the book. Because if you go to look at the literature, at least when I first got into this, it was like 40 years ago, and I went to the literature and I'm looking up all the things in the library about ozone. Like everything was negative. It was all about ozone as a toxin and a pollutant and this and that, and everything was bad. How do you get rid of ozone? How do you protect yourself from ozone, et cetera, et cetera? But what that's all about is when ozone is mixed in with pollution and you breathe it. That's the problem. Our lungs do not have the ability to withstand the oxidant stress of ozone. Our lungs can't handle it. So that's the one place in the human body you can't put ozone in. You do not have people inhale ozone. It's bad for the lungs. Every other place has enzymes that protect and actually are used and stimulated by ozone. But the lungs don't have those enzymes. And that's the deal with pollution. You have ozone that's mixed in with this pollution, and then you breathe it in. That's not good. Other than that, it's perfectly good.
Very good. Well, okay. Well, as we kind of wrap up here, I always ask my guest at the end of the show here, if you could give us one health tip that would make us healthier today, what would you say to that?
Okay, let's see if we can't come up with something terribly interesting. Let me just say this, and I was just thinking about this today. One of the best things that alternative doctors can do for a patient is to eliminate some of the medications they're on. In the old days, back in the 60s, when I went to medical school, my chief of medicine, he went out of his way to call us on the carpet, any of us, if we were giving more than 2 drugs to our patient. T.E. Woodward was his name, and he'd go crazy. He was an old timer. He'd say, if you guys have to give more than 2 drugs to your patient, you're doing something wrong. So you should be better at your administration of drugs than that. Because the more drugs you give to the patient, the more likely that they're going to have a problem from the drugs, because nobody knows what all these drugs mixed together is going to do. Well, it's not uncommon these days to have patients come in and see you and they're on 7, 14 drugs.
Mm-hmm.
They're seeing all these different specialists. Each one is prescribing a drug, and God knows what's going on in that patient. And I'm reminded of Sir William Osler. And what the listeners want to remember is that Sir William Osler was the head of the Department of Medicine, the first head of the Department of Medicine at Johns Hopkins University in the late 1800s, early 1900s. He was considered, and still is considered by most people, to be the father of modern medicine. So he's a big guy, and he wrote a number of books, and he did a lot to take us from the old style of medicine prior to his arrival into new modern medicine, which has helped so many people. And Sir William Osler is on record as quoting, "One of the first duties of a physician is to educate his patients not to take medicine." That's a phenomenal statement. If Sir William Osler were around today, seeing some of the patients I'm seeing, he'd roll over in his grave because they're on way too many pills. So I guess the pearl I have for listeners out there is, if you're on a lot of pills, if you're on over 2 pills, you really ought to talk to a doctor that knows how to find natural substitutes for those pills. So many of those pills can be eradicated if you change the way you eat, if you change the way you sleep, if you change the way you think. You're doing something wrong that requires all those darn pills, and they're going to come back and bite you in the butt at some point. So I guess that's the thing I'll leave people with. You think about that and see somebody such as yourself, for example, that can help people to decrease the number of pills they're taking.
Yeah, and that's fantastic advice. And I was sitting here thinking, as you were saying that, I've had a lot of doctors, and most of them are kind of in this space, functional medicine doctors, whatever, on this show. And I think that you're the first person that's ever said that. But fantastic advice. So, well, okay. If people want to find out more about you, specifically about ozone, the book is called The Ozone Miracle, Dr. Frank Shallenberger. Your clinic is in Reno, Nevada, and is the website antiagingmedicine.com. Is that correct?
That's right. Yeah.
And so any other way that people can just kind of find more of your stuff and resources out there?
Okay, couple of things I would say is there's a lot of stuff on my website. It's educational in nature. They can also, I'll give you a couple other websites they can go to find doctors in their own area that have been trained how to do ozone therapy. And one of those websites is AAOT.us. AAOT is the American Academy of Ozone Therapy. And so .us, and that lists all the doctors that have been certified by that academy as being proficient in ozone therapy. You can also go to another website called oxygenhealingtherapies.com. Oxygen healing therapies being plural, and find physicians there that are in their area. And let's see what I wanted to also skip my mind what I wanted to say in terms of resources that people could use. You mentioned the book, and there was something else I wanted to say, but I can't remember what it is.
Okay.
But that's a good start to learn how to use these things. Oh, I know what it was. Is if you're a doctor or a practitioner, licensed practitioner out there that would like to incorporate ozone therapy into your practice or to learn more about it, you can go to Shallenbergerozonecourse.com and you can learn about the seminars.
Okay. All right. Well, very nice. Well, thank you so much for your time and just expertise on this, and your training has been great. I've really enjoyed incorporating it into our clinic and into our practice. So just thank you for what you do. Appreciate everyone listening. And Dr. Shallenberger and everyone, we will talk to you all next time.
Okay, thanks, Greg. Great being with you.